Dear colleagues, I am a right-handed person, but presently I am training my non-dominant left hand to hold the Phaco handpiece for capsulorhexis and other maneuvers. By this time main incision has been made, and this is the paracentesis incision on the left side of the main incision. I am going to stain the anterior capsule of the cataractus lens underneath an air bubble. Here goes the air bubble. Now trypan blue dye is sprayed over the anterior capsule of the cataractus lens, and immediately after 5-6 seconds this dye is washed out. Now viscoelastic substances injected into the antechamber. I use 2% hydroxypropyl methyl cellulose. Here it goes. This is HPMC. And now one more side port is being made on the right side of the main incision. This side port has been too far. It should have been at around 11 o'clock, but it has been at around 9 o'clock. Now I'm going to incise the capsule with my left hand, taking a ureter forceps in my left hand, holding this flap, and I'm going clockwise. I found that with my left hand I find it easier to go clockwise for doing capsulorhexis, and with my right hand I find it easier to go anti-clockwise, and it has been a fairly controlled movement, a nice round rhexis with my left hand, and I am happy. Now I am going to do hydrodissection. Here it is. Fluid wave is being passed just underneath the anterior capsular rim, and the fluid wave goes to the other side. The nucleus is depressed towards the vitreous cavity. The fluid comes forward. The nucleus is rotating freely, and it's fine. Now I'm taking the Phaco handpiece in my left hand and entering into the anterior chamber. Here it is. Now I impale the tip into the lens matter, but this is not yet good. I have to work it out for some more time, some more cases to become good at it. This hold is good, but my right hand movement was not good. So this nucleus didn't divide into two halves. I rotated the nucleus and trying it at another place. At this time I could get a crack, but it's not a good crack. However, I have to, when a particular technique doesn't work, I have a very good technique that is called do it somehow technique. This technique, taking care of the corneal endothelium and taking care of the zonule and taking care of the posterior capsule. These three things, if we take care of, we can do any maneuver and safely complete the case. In this case, the chopping was not good, but I am managing it somehow. So it has become a dish technique, do it somehow technique in this case. And this technique is not a slow technique. It takes only 1 minute more than if the direct chop, of, horizontal or vertical, if it works well. That's it. This is the last nuclear fragment. This is Oatley Catrix 3 Phaco machine. And now this part of the surgery is edited. Bimanual irrigation aspiration was used to clean the cortical matter. And now I am implanting a lens under irrigation. I am pushing the lens with my left hand and the irrigating probe is in my right hand. And I could place the lens in the bag. That's it. Now the side ports are hydrated. So in this surgery, only the cortical cleanup has been edited out. The rest of the surgery is here. Thank you very much for watching. The idea is to train our hands, both hands, so that in some cases, we can handle tough situations. Thank you very much for watching. Hope this video will help you in your surgical skill development.